Welcome to the West Clinic Hellness to Wellness podcast. This is taking people that are sick, out of hope, frustrated or confused with their medical recommendations, or are searching for another pathway to health, and it's finding incredible patient outcomes of people just like you. And it's not just saying it. You can see and hear the hundreds of patient success stories on our website, blog, YouTube channel, and of course, right here, coming at you with over a century of patient success in the West Clinic system. Here's your host, Dr. Jason West.
All right, you guys, welcome to the program tonight. As so often happens with our program, we've done over 125 episodes on different conditions like fibromyalgia and arthritis and hormone balance, thyroid balance. Well, I got a request. Well, what can you do for infertility and miscarriages? And so that's what tonight's episode is on, is about how we can help support the process of basically imbalance and lack of energy and not enough precursors and everything. So infertility and miscarriages, it's a multiple part series. There's a lot to cover here. And one of the reasons I was excited to share that is we just had another patient that was told you can't have children, and guess what? She's expecting. She's well along, and yes, we've had people that haven't responded, but I get really good outcomes with this. It's a combination of using a nerve reset therapy. It's an NHP, which is the natural hormone precursors. It's the fertility vitamin, which is a vitamin E. It is selenium. There's also some chase tree extract and ashwagandha. There's a whole bunch of other things that help. So I put this presentation together. I'm excited to share it with you. I came inside of my studio and did it a little bit earlier today. And so I'm going to walk you right behind this and into the set, right over on this side, right over there. And we're going to get in front of the green screen and I'm going to walk you through that. But not only that, it's not just me saying it. I've got some really neat patient testimonials. So without further discussion, let's get right into this and go into infertility. Here it is. What's the deal with all the miscarriages and infertility treatments that seem to be more and more, or maybe it's because we've had success stories that we see it quite a bit. If you have questions of what you can do from a natural perspective or want to check out a functional medicine approach to miscarriages and infertility, this is the video for you. I'm your host, Jason West, coming at you with 100+ years of clinical experience. And on behalf of the West Clinic team and the West Clinic patients, I just wanted to share with you information that may help you or someone in your inner circle with this difficult condition. As always, if you're not picking us up live, you can pick us up on the replay on my YouTube and Facebook channel, drjasonwest.live. It's actually a website that you can go to. You can download the resources and you can see the presentation. And not only that, we've done over 100 shows on different chronic healthcare conditions. And so we're coming at you every week. This is going to be a 3-part series, at least, on infertility, hormone imbalances, miscarriages, and what to do about it, and some of the neat natural things that you see really good outcomes. And not just me saying it, we're going to queue up some testimonials for you to check out right here. Hello everyone, Dr. West and Cori, excited to share everybody a neat story about an amazing patient outcome. And so, Cori, we talked a little bit about this. I haven't seen you for a couple of years, so it was nice to reconnect.
Yep.
That always means that I'm doing a good job when I don't see patients for a long time. But we were kind of going through the timeline, and you said, hey, I first came in about 2010. And what brought you in?
Well, I had 3 ectopic pregnancies before that, and one of them resulted in a tube being removed. So I only had 1 tube, and we were starting the path of fertility treatments, just barely getting into it when my mom suggested I come and visit with you.
And so you came in, and we decided, hey, let's get rid of bad nerve memory, which is a treatment that we do called neural therapy. And then it was just fun to hear what you said happened, because what happened?
Well, I went home, and a couple weeks later took a pregnancy test, and well, more than a couple weeks, but the next month I was pregnant, and it was a viable pregnancy. It went full term and got a beautiful daughter out of it.
Okay, and she's 8 now.
She was
right?
8, yes.
And then something else happened. You came back a couple years later.
Yeah, maybe a little bit of superstition, from going through the process the first time. But knowing that it worked, we wanted to have another successful pregnancy. And so we came right back and got a second shot. Within a couple weeks after that, got another positive pregnancy test and a son.
So we have a little girl, little boy, and then because it can't be possible, but is it possible? What happens the third time?
Third time, another wonderful pregnancy and another wonderful son. So I can't thank Dr. J enough. And if I could go to Vegas with this type of luck, I would go all the time. But it's not luck.
Yeah.
It's hard work and dedication and knowledge, and I just appreciate all that you have done for me and my family.
So amazing story. It usually doesn't happen that it's 3 for 3. It takes a little bit to get everything balanced, but what a neat story. And it was funny because I walked in and Cori said, look, I don't want to walk out of here with, another pregnancy. So we kind of chuckled about that. Exactly. Not here for that. We're here for some other health conditions, but it was just a neat story. So many times what happens for women is they get a bad memory inside the pelvis, and the body accept that to be, quote, normal. And so just like if we called up tech support and we said, hey, we reboot the system, turn everything off, turn it back on. That's what we did for Cori. It's just a nerve reboot therapy. It's a German treatment called neural therapy. And these are the outcomes that we expect. I mean, we really have good outcomes with hormone imbalances and infertility issues. So Cori, thanks so much for allowing me to share this story of hope with other people. It's okay to put on social media.
You bet.
So this is Dr. West and Cori on an amazing infertility condition. And we'll see you guys on the next video. Hey guys, Dr. J here with a daily dose of vitamin H. I'm just really excited to share a patient story with everyone. This is Hillary and Hillary's baby, Brindle. And Hillary, when you first came to the office, how are you feeling?
Very tired, very fatigued.
Like exhausted?
Yes.
Could not function?
Yes.
And the medical, recommendations or treatment plan was what?
Just take 6 times a day of iron.
Just so the option for her energy was just take iron. It wasn't making her feel very good. She couldn't function. So we decided to come here. And what treatments did they do?
We did the IV treatments here.
So we did some vitamin infusion and we did some nutritional supplements. And how are you feeling now?
Great. I
So-
haven't felt this great in 5 years.
Yeah, so she told me this morning when we do our reevaluation, she said after the last treatment you went home and
Redid my kitchen.
redid the kitchen. So she went from literally being bedridden to be able to do the projects. And your mom said what?
She started crying. I
Sorry.
couldn't believe it.
It was a really, really neat experience. So just correcting physiology, putting the vitamin building blocks into the system and treating the body with what the body needs, a really amazing outcome. We're actually telling Hillary, you don't need to come to the office anymore, which is always the goal, is to make it so that you don't need us. Is it okay to put in on social media?
Yes, absolutely.
And if anybody is contemplating treatment at the office, what would you tell them?
Tell them no questions. Just go right in.
No questions, go for it. This is Dr. J with the Daily Dose of Vitamin H. We'll see you on the next video. Now you can see from these different success stories, it's not just me saying it. So let me tell you what we've done and then how to get you information of how to balance hormones and create an environment that is really good for bringing life into the world. So with that being said, I wanted to go over a couple things. So this is how we start to do the workup inside of our office with any chronic and complicated healthcare condition. We want to make sure that we balance out, number one, the hormones. It's amazing to me how many women come into the office and I say, what's wrong? Well, I'm struggling with female health, whether it is lack of energy, whether it is lack of sex drive, whether it's infertility, miscarriages, perimenopause, menopause, hormone replacement therapy. And I'll say, have your hormones been tested? And they'll say no. And so the best place to start with any type of female and also male healthcare conditions is to do a complete metabolic panel, a complete blood cell count, looking at C-reactive proteins, a vitamin D level, a T3, a T4, a TSH, a total iron, a ferritin level. I mean, there's so many good, simple tests that you can do to develop a baseline from a vitamin and a mineral standpoint. That's number one. Then the next thing that we're going to do is we want to talk about how we can balance those out. Now, I like to do something called NHP, which stands for Hormone Natural Precursors. Now, the reason why I say that is because as much as possible, we want to give the body 2x4s, building blocks, and sheetrock so that you can make your own house. When we start giving exogenous hormones to people, which sometimes is needed, but most of the time, you give the body the building blocks, which is the precursors to make estrogen, progesterone, DHEAS, testosterone, cortisol, thyroid hormone, thyroid stimulating hormone, and all of the different hormones for the body. You work on the liver, you give the building blocks, then you get really good outcomes. So the first thing to do a blood test, look at those levels. The next thing to do is to do a hormone test. And we want to look at the multiple hormones. One of the best ways to do this, and this is something that is simple you can do inside of your house to look at how your hormones are functioning, is to do something called Ragland's test. Now, this doesn't give you numbers, it gives you information. So what does that mean? A lot of tests, you take the test and it'll tell you, your calcium level is 9.8, too high is over, 10.3, too low is below 9, like it gives you a number. Same thing with cholesterol. You want to see your cholesterol, somewhere around 180, give or take, in my opinion. Same thing with your sodium levels, it should be around 141. Now, the reason why I say they give you quantitative information, it gives you a number. If you want to know what's happening, you need to do a little bit of functional medicine test. This is a really good test that's simple, inexpensive to check out and see what's going on with your hormones, is to just do a standing, lying blood pressure and track your pulse rate. So was put together by Dr. Ragland's, who was a famous endocrinologist. You take your blood pressure lying down, it should be 120 over 80 with a pulse rate about, somewhere between 60 and 90. Then you stand up, you immediately take your blood pressure again. What should happen so that the blood doesn't run out of your head is your blood pressure should go up to 6 to 10 beats on the systolic and the diastolic, and your pulse rate should stay the same. Your body, you need to create more horsepower, which is more cardiovascular output. Now, what happens with people with chronic stress problems, and if they're not making the right hormones, is they stand up, the blood pressure drops, the body to compensate so the blood doesn't run in your head. What it does is it increases your pulse rate, and then what happens is you get into that chronic fight, flight, faint, or fight response, right? So that's the F's associated with stimulation of the nervous system. Well, the body can't tell, is it an anaconda? Is it a bear? Is it a snake? Is it a tarantula? Is it your bills? Is it your relationship? Is it the political environment? Is it not sleeping? Is it some difficult relationship in your life? Your body doesn't know which one it is, so it creates the stress, depletes hormones. So this is one of the most important things to do with any hormone balance problem, is to figure out, is there a way to channel stress? Now, I gotta tell you, it's easy for me to say, and it's hard to do. And by the way, everybody's trying to figure it out. Hippocrates and Paracelsus and Aristotle and Plato and Benjamin Franklin, like any of these big thinkers, they're trying to figure out how's the best way to navigate life. And guess what? We're all trying to figure out too. But this is why I keep saying in all of the live presentations that we do, you gotta have a way to channel stress. Is it listening to music? Is it playing music? Is it prayer? Is it meditation? Is it writing in a journal? Is it talking to yourself? Is it gardening? Is it exercise? Is it sexual relations? Is it a hobby? I mean, for me, I just think when I ride my snow bike or my dirt bike, I just think it's such a way for me to communicate. I'm thinking the whole time while I'm doing this activity. You can tell that I've worked really hard on this to have my wife let me do these activities, but that's one of the things that is a stress outlet for me. So whatever it is, there's no right or wrong answer, it just needs to be for you. So do the simple test, look at your hormone functions, that's number one. You can run some blood tests, a progesterone level, an estradiol level, cortisol levels, testosterone levels, follicular stimulating hormone, luteinizing hormone. I prefer something I think is the most accurate is a salivary hormone test, because the hormones aren't attached to a transport molecule in the blood. It just is basically free hormones. I think this is the most accurate way to test hormones. And guess what? If you go to the internet and you look at salivary hormone tests, you're gonna find some good stuff and you're gonna find some bad stuff. This is just my opinion. And this is the way that I like to do the workup. And then we start balancing those out. Is it progesterone levels? It's been my experience that most women with estrogen and infertility, with infertility and miscarriage, like they have an imbalance of estrogen. They're estrogen dominant, they're progesterone deficient. A lot of times their energy levels are down, which you can look at that as a blood test. You could do that with a Ragland's test, or you can look at the DHES number in a salivary hormone test. One of the other markers that you can use for energy levels, it's used for many different things. Your alkaline phosphatase is a bone, liver, muscle enzyme, but also has a component for the adrenal gland, and it's a zinc-dependent enzyme, which can give you a little bit of insight just into how the hormone system is functioning. So all of these different tests, and being a healthcare provider, I just love the different data points. All these different tests are helpful to figure out how do we balance out physiology. Now, one of my favorite things to do, and this is what's inside of our free report, is to talk about a simple, inexpensive infertility and miscarriage vitamin. Now, if you take this, does it mean that you're immediately going to become pregnant, or are you going to have easier pregnancies, miscarriages? No, but it's one of the things that I've seen really good experience with. So it's just like in healthcare. Is there one path to the mountain? Is there a fix for everything? And there isn't. But I love this vitamin that's good for tissue repair, connective tissue disorders, pituitary imbalances, sex hormone balances, infections, cardiovascular needs, and postoperative healing. It helps anti-scarring and tissue resistance to stress, supports skin, muscles, ligaments, supports the cardiovascular system. It's a source of a manganese, selenium, and aids in pituitary function, and this is a natural source vitamin E. This is, and again, these statements are my clinical experience. It's stuff that my grandfather taught my dad, and my dad taught me, and I've seen it give some reasonable clinical outcomes for pregnancy concerns and miscarriages. So vitamin E, and the most important source of vitamin E, of course, is your knife and fork. But the second component is I like the vitamin E from a natural source. So when it's made inside the lab, I think you're missing a lot of the beneficial nutrients that you get from your knife and fork, your phytonutrients and your cofactors that make vitamin E work. So one of the first things that I love to help patients with is let's get you on a natural source of vitamin E. Another one I like, there's some really neat herbal things that I think are really good for the different conditions based upon the outcomes. Like there's a component of what we call natural hormone precursor therapy or protomorphogen therapy, where I like to see using a cow ovarian extract as a natural supplement. It's not something that interferes, in my experience, with prescribed medications and stuff like that. I just see really good outcomes with an ovarian extract. I also really like something called chlorophyll. And chlorophyll is something I talk about all the time because it's a blood purifier. It's my opinion that if your blood is healthy, then you are healthy. And that's one of the things that we keep telling people. If things are healthy at a cellular level, then you are going to be healthy. And so vitamin A, vitamin E, vitamin D, vitamin K are so important to helping your blood to be healthy. And my favorite place where that comes from is green leafy vegetables, spinach and kale. There's a lot of those fat-soluble vitamins in wheatgrass shots and stuff like that. I think that's really good to help your vitamin system. Now, the last component, and this is a factor that we see in literally all of the success stories that you've seen before, is the nerve reset therapy. Nerve reset therapy is when the body gets injured or has a hormone insufficiency or trauma, and again, you can't separate the mind from the body and the body from the mind. They come together like that. So stress and relationships and past stressful problems, abuse, physical, sexual, and emotional abuse all have a factor in these cases. And so what happens is you try and work your best to do the mind-body healing. That's why we have a mind-body healer inside of our office to work through that. But the other thing about it is I believe that nerves have memories. And so if every once in a while I'll have a rancher or a rodeo guy come into the office, and they'll be out practicing, and they'll get the rope caught around the finger, and then the cow will take off, and it pulls their finger off, and they'll come in and say, Dr. West, my finger's killing me. Even though it's not attached to the body, that's a frequent feedback. Sometimes people get it after infections, and you can have a shingles outbreak, and the shingles go away, and then the nerve still hurts. So you have post-infection, neuralgia, or you can have phantom limb syndrome, or you can have phantom gallbladder syndrome. And so many times the nervous system gets set on a pathway that isn't healthy, right? And so what happens is you want to live up here, and you live down here, and so many times one of the nerve plexus that controls the female, basic hormone system, the uterus, the fallopian tubes, it can be stuck inappropriately off or on. And so we call that an interference field. And so if your body was a computer, what happens is you call up tech support, and tech support will tell you, turn everything off and turn everything back on. You want to reboot the system. Well, there's a wonderful German technique called neural therapy, Neural. I talk about it almost on every live. I've done some video components about it. You can see that in the report, the free infertility miscarriage report, available at drjasonwest.live. You just go there, you put in your information and an email so that we can keep you abreast of everything, and the report's there for free, and it's called neural therapy, and it's a way to reset the nervous system. It was developed back in the 1920s by a father-son combination, a Dr. Huneke, and then a father-son combination named Dr. Doach. Dr. Doach Sr. wrote a book about it called The Manual of Neural Therapy. I just think it's one of the greatest medical texts of all time, and it talks about how you can reset nerve control for difficult hormone conditions. Infertility and pregnancy is one of them. So there's basically a way to reset the pelvis, there's a way to reset the thyroid, there's a way to reset the central nervous system, and then if there's a scar component. And so if you reset the nerves, if you balance all of the biochemistry and the hormonal component, then you can have an outcomes like you've seen before. Now, I don't want to mislead anybody and get any woman's hopes up that's struggling with this difficult condition, because I have had people that have failed, and I have had things where it hasn't worked. I mean, we've tried and tried, and it's really fun and exciting to be a part of these stories that you've seen. It's also tough when it doesn't work. So I don't think there's any for sure thing that works in any condition in healthcare, but if you have tried a bunch of things, or if you just don't know what else to do, there's a really neat option there that may help you. So we're going to talk more in part 2 about what I think happens in miscarriages from an alternative and functional medical perspective. I think there's some interesting things they're going to be in part 2, which is coming up next week. This week, we just wanted to give a real quick overview, tell you about natural source vitamin E, natural hormone precursors, why fat-soluble vitamins help to purify the blood, get some blood tests, get some hormone tests, develop a baseline so that someone can really help to try and put your physiology back together. As always, I'd like to thank my team and my sponsors, the team at the West Clinic, and that we can really, really have a fun and enjoyable place to work, because it's all about the patient outcomes. We don't care who gets the credit as long as you get better. Also, my sponsor, Personalized OTC Therapy, which stands for Organs, Tissues, and Cells. They're always trying to help me make different types of health and nutritional supplements. By the way, we have a supplement pack over in our free download source where we talk about the vitamin E and something called KS10N and some proteomorphogen therapy and some other things that I think from an herbal standpoint are really good. You can get that inside of the free report. We talk about the neural therapy. So that is our master class tonight about the beginning of female health. And again, this is for females struggling with infertility and miscarriages, giving them some ideas that may help. Of course, there's some amazing medical professionals out there doing in vitro and artificial insemination and some other things. That's not something we offer at the office, but we have had some really good outcomes with this. So that is our show tonight. If you missed the live component, make sure you can pick us up on the replay. It's there for a week. And by the way, it's also on a podcast that we've put together. You can pick us up on Stitcher and Apple iTunes and anywhere you got a podcast. It's the Dr. Jason West Thrivers program, not just living, you want to thrive. That's our program for tonight. I'll see you on part 2 next Wednesday night, same bat time, same bat channel, which is 6 o'clock on YouTube and Facebook. That's our live. I'm getting ready to step over into our Thrivers program, which is for my patients and people across the street, across the country, that do a special virtual office visit with me where I do into their live question to answer periods. It's called Thrivers. If you want any information on that, just type in #Thrivers inside of our YouTube comments or Facebook comments, and my team will pick you up. I'm Dr. Jason West. Here's to your energy, balance, and longevity, and I'll see you guys next week.
Thank you for listening to the Hellness to Wellness podcast. Every week, we're sharing stories of people beating their disease or restored hope, treatments most doctors don't even know about, and information you need to live your life at the highest level. Remember, live. Don't just exist. Do us a favor. Please like the show and give us a rating on Apple Podcast or Spotify. It really helps to share the message of health and hope. For additional resources like booking appointments and free video masterclasses, check out www.drjasonwest.live. It's internet information you can trust. Here's to your energy, balance, and longevity. And we'll see you on the next Hellness to Wellness episode, where you'll be saying, man, I feel good.